Hi, I'm Sarah Vavra, and thank you for watching. This series right now is all about the back. Um, Something like 85% of Americans will suffer from some kind of back pain in their lives, and for a lot of us, it shows up in that lower back area, the lumbar back. There are lots of reasons why the lumbar back seems to get uh, the brunt of our dysfunction and pain, and we can go into that another time. But part of the reason I think is because we ask that lower back, the lumbar spine, to do things that it's not designed to do. So let's start off with some stretches for the hips. If you happen to have a strap or one of these bands, go ahead and get that. You can also use a towel or a belt or something like that for these stretches. It's not essential that it's one of these. Also, you might want to use a pillow and put that underneath your neck. Those of us that are on the other side of 50 sometimes need a little support back there. I don't know, you might want to have it and you might be 30. Let's just see where we go. We're going to come all the way down to our backs. And as we come down, supporting ourselves, let's try to anchor that lower back into the ground. And one of the ways to help give support to that low back is to bend your knees and just take that pressure off of your hips and off the lower back. Roll the shoulders back, let your arms relax, and just notice what it feels like to be in this resting position. Before we do the stretches, we're going to set the tone for ourselves by doing a little bit of breathing. When we breathe, and this is very good for the lower back, but when we breathe here in this nice getting used to our bodies, we want to breathe in so that we feel our belly expanding. You want to feel this sense of swelling and floating forward as the breath comes in. And then when the breath goes out, letting the belly drop down. There's no movement in your lower back except for the pressure of your breath. You just want to make sure that you have this full breath. The count on the breath is going to be a 4 count in. We're going to hold that breath for 2 beats and then exhale that breath out for 6. We're not forcing it. We're just exploring breath in the body, letting the breath go down and expand, holding for 2 beats, and exhaling. I'm going to put my hands on my belly, and I suggest that you do too. It's a good way just to see what's happening here. Breathing in, 2, 3, 4, hold, 2, exhale out, 2, 3, 4, 5, 6, and breathe in, 2, 3, 4, and hold, 2, and exhale, 2, 3, 4, 5, 6. Breathing in, 2, 3, 4, and hold, 2, exhaling, 2, 3, 4, 5, 6, and continue at your own count. And hopefully that's helped to calm your nervous system a little bit, which is very important. An overstressed nervous system will start to make your back hurt. It's one of those weird things that happens in the body. There's much less pain when our nervous system is calm. From here, we're just going to let our arms come out to the sides and slowly let the knees go from side to side. And as we do this motion, we're paying attention to that lower back, and we're making sure that there's literally no movement in that lower back. We want to feel that action happening at the hips, and we're noticing where we start to feel a sense of a strain. Now, you might also start to feel this in your shoulder blades and in your neck And that's just giving you some information about how you use your body, what things tense up when you use your legs or your hips. And as much as you can, just keep relaxing. Let your upper body feel very heavy, very relaxed. We're not going anywhere. We're not trying to prove anything. Just observing our hips. Walk your feet together, keep the knees together, and see what happens when you do this range of motion from here. And if you want to let your outside foot come up, you can do that. Do you want to still keep that lumbar spine stable and quiet, lower back stable and quiet, and keep breathing. So again, inhale as the knees go over, exhale, fill that belly up when you inhale. And exhale, good. Walk the feet apart, wider than your hips. And again, let the knees go from side to side. So we're going to do this several times, but not as many times as you would do on your own. If you were doing this practice on your own, you would maybe do 10 reps in each direction, in the wide position, and in the narrow position, and in the moderate position. Let's get this nice, easy motion. And we're just going to rest and then walk the feet back so they're separated about hip width apart. From here, keeping that back stable, we're going to take the right leg in towards the chest, and hands are going to come to the back of the leg, and we're going to pull that knee in. Now, as you draw the knee in, I want you to notice what you're feeling, where you're feeling it. Relax the shoulders, lengthen the low back down without arching. So we want to just keep that nice support of the ground. Inhaling and exhaling. And as you hold this, see if you can inhale, fill the belly up, and exhale out. And then very easily putting that foot on the ground, keeping that back down and relaxed, and only going as far as you can. We'll do the same thing with the other leg, bringing the leg in, supporting it, and hugging it in. So this is a really good opportunity. Just keep breathing here. It's a very good opportunity to notice if you're able to fold that leg in, or if you have a tendency to shift your hips. So this is one of those places where inadvertently we're trying to help the leg come in, so we twist our hips. And we don't want to do that because that's not great for the lower spine, right? For the lower back. So keeping your hips stable, maybe go back to that beginning and then see if you can lift the leg up and how far can you fold it in without twisting. Gathering information. Very good. And then release that leg down. We're going to take this knee in again, so bring that leg in. And this time, holding on to the back of your thigh, you're going to guide the knee a little bit more towards the center and then pull it in. So you're almost thinking about the knee wanting to come over to the opposite shoulder. And if you have the space, you can hold on below the kneecap and pull it in. There's a couple of different areas where you might feel it. The idea is that we're starting to bring this into this whole area in the glute. But you might also feel a little bit of a pinching sensation in the inner thigh. Relax the shoulders, breathe, hugging it in, and try not to hitch that hip up. How's that? Good. And then since we have this leg here, we're going to start to take the knee out wide. And again, we want to keep our hips down. We're going to take the other hand, that left hand, so I've got my right knee in, and we're going to start to reach across the shin and guide the shin and the heel up. This knee is going out further to the right, And as our body releases, we're going to start to pull the foot a little bit more in, cradling the foot, and maybe pressing the leg out. Now, I know in yoga, we often bring this other foot up, this other leg up, and we hold on to the back of the thigh. But for today, we're not doing that because, again, that has a tendency to get us to shift our hips and rotate. And we're not focusing on any of that. We just want to get that opening in the hips. So keep drawing that leg in and finding the range of motion that feels right for you. Try to keep your hip in a nice stable place. And then also rest your foot on your thigh and open up here. But again, try not to get in this torquing motion, right? Just want to still keep that open place. Good. And then we're going to cross the leg over and notice how this feels and gently let the knee move over to the left. Just a little bit. We still want to keep this glute down, particularly where the sacrum is. And then uncross. And we're going to pause for a moment. Bring your hands back to your belly. Inhale. That nice 4 count with the breath coming in. Hold it at the top. And as you exhale, imagine you're sinking down through the lower back. And again, we're going to do that without tilting the pelvis. We want to feel the muscles dropping down, feel the pressure dropping down. Breathing into the belly. Holding that and exhaling all the way out. Good. And then we're going to bring that other leg in, right? Hugging the leg in. Guiding it more towards the middle. And pulling it in. And adjusting. So again, hands could be on your thigh, back of your hamstrings. Pulling it in. Bringing the knee towards the opposite shoulder, not allowing the body to twist. Breathing into the belly. And then as your body is ready, start to guide the knee more out towards the armpit on the same side. So I'm on left side, reaching across the shin, if you have that space, and start to guide the knee out wider. Noticing if you're trying to torque or twist your lower back and eliminating that. We don't want to do that. Continuing to bring that foot closer and closer, bringing it in and pushing the knee out. Now, remember I was talking about the knee being a stable joint, right? Stable, flexible at the ankle, stable at the knee, flexible or mobile at the hip, and more stable in the lumbar spine. So even though the knee's in this funny position, what we don't want to do is feel any twisting in the knee. So I'm still keeping it in that hinge. All I'm doing is rotating from the hip. So if you feel anything in your knee, if this is uncomfortable for your knee, you know then that you're probably putting the knee in a position it doesn't like. And so you want to come out of that and not do that, right? And then guide that leg back and put the foot on the ground. Good. Again, take a nice big breath in. Exhale down and all the way through the lower back. Good. Now we're going to take that strap or that band or the towel or whatever you have and put it on the bottom of the right foot. Right? And then extend that leg out at an angle. And we want to have some support here. We're not trying to keep that quad nice and relaxed, the front of the thigh nice and relaxed at this stage. So we're just going to start off with this position that we can sustain pretty well. We've got this support here. Then slowly start to bring the leg up. And so you're using the strap to bring the leg up and trying to keep these muscles nice and soft as you can. And we're bringing the leg up just to the place where we start to feel a stretch. So again, this is not extreme stretching. This is where's the first place I feel a stretch. And then again, asking yourself, are you feeling anything in your lower back? Does this feel good? Just being in that place. If you can, and you want to, get a nice stretch in your calf, you can flex that foot, pulling the toes towards the shin. But again, try to relax the quads here. Breathing. Now, you might notice I still have my left knee bent, foot's on the ground, and that's to give my hips and my low back particularly a little bit more support. Some people are able to extend the leg at the same time, but that's a little more stressful for my lower back. I want to keep that sense of support and stability. Good. So we're going to breathe here and maybe bring that leg up a little bit higher, as long as you're not peeling your glutes off the ground. Good. All right, from here, I'm going to lower just a bit to take some of the tension off and relax my right arm down to the side. I'm going to take the right leg across the body over towards the left, only till I feel that stretch, and I'm not going to allow my lower back to twist. I'm not going to allow the hips to come up, and I'm not even going to twist at the thoracic, which is an area that you can. Just going to feel that stretch and hold that. Right, it's a pretty good stretch. Nice for all those muscles that attach at the hip. Now we're going to give ourselves some length in the band or the strap and lower the leg a little bit at an angle and bring it across. And at this stage, if you want to extend that left leg, you can do that too. And take it across. Again, keep the hips down. Shoulders staying down. Everything's nice and relaxed. Still breathing into the belly. And then see if you go down a little bit lower. And maybe a little bit lower. And so you can play around with these angles as to what's best for your body. And then we're going to allow that leg to come back to center, bend the knee, and release the strap. And place the foot on the ground and give yourself a little bit of a wobble here. We'll do the same thing with the other leg. So bend the knee, both knees are bent, and take the strap and put it on the bottom of that left leg. Extending it out, finding that first place where you feel just the beginning of a stretch. We're really in that beginning of a stretch place, not in the, I really feel it. See if you can continue to keep that full, deep, easy breath. And again, relax your shoulders, the back of your neck. Flex at the ankle. See what you notice for your calf muscles, and then try to keep these quads nice and relaxed. Easy. Leg might come up a little bit higher. And we could start to take that leg over and across. And you might release the left arm. So again, think about the lower back is supported, it's stable, and you might take that right leg down, and the leg might go across and over more, and down, and we're just taking our time. And notice if your lower back is able to stay stable, or if you've inadvertently, like I did, notice that I arched it. Discover all kinds of things about yourself. And then bring that leg back to center and release the strap. Bend your knee and allow it to wobble. All right, and then we're going to take our arms down by our sides. We're going to start to open up through the front just a little bit. We're going to lift up those hips, not very high. And we're just noticing how that feels in our body. Take a nice big breath in and exhale down. All right, so now it's important for us to open up through the front of the quads and across these hip flexors, because that's part of the hip as well. And the way we're going to do this is we're going to start off on our side, as long as that's okay for your body. So keeping that spine nice and relaxed, we're going to take the legs together and bring both knees over to the right, and we're just rolling our whole body over, and hopefully that works pretty well for you. You can use a pillow if you want, or you can rest your head on your arm like this. From here, we're going to pull these knees in and keep that low back long. So we're going to curl the tailbone under and reach down and see if we can find that ankle. And then slowly start to guide the leg back. So heel is coming in towards the glutes, and pubic bone, the lower part of the pelvis, is moving forward. And ideally, you're getting this nice stretch across here. If that doesn't work for you, you can also use your strap, right? And you can put it on the bottom of your ankle, like wrap it around your ankle, and then guide that leg in. Now, hold this position unless you feel like it's better for you to be on your stomach. And if it's better for you to be on your stomach, you can come all the way down here and draw the heel in towards the glute, or maybe even hold on to your foot and draw the leg in. But again, let the pubic bone press down towards the ground and breathe. Fill the belly up and breathe. Good. Releasing. Take another big breath into the belly and exhale. And either roll over onto your side on the other side, or if you want, using your strap or holding on with your hand. Do the same thing with the right leg or your other leg. The stretch here is on the top of the thigh and maybe even up into your pelvis. There are other ways to get here. There are other stretches that help to open up the front of the leg and the hip flexors. But this is a nice way of doing this, supporting the lower back and focusing on our breath. And then we'll release. Okay. And then bring your hands under your shoulders, pull the belly in, and if you're able to push up, you can do that. Or, again, you might roll over onto your side, curl those legs in, and make your way up to a seated position. Good. So those are really good stretches for the hips. The last stretch that we're going to do is for the inner thigh. And because these muscles come up and they attach on the pelvis, they can also impact how the hip feels. So we're just going to stretch that one leg out and sit up nice and tall and bring the body forward just a wee bit. We want to keep a hinging motion at the hips. Right. And we'll do the same thing with the other leg, extending and sitting up tall and coming forward. And then releasing. Good. Good. So hopefully now your hips feel a little bit more open. And so in our next video, what we're going to do is do a little bit of mobility work for the thoracic spine, which is that series of joints that are above the lumbar spine. So we just worked lower, and now we're going to go upper. Thanks for watching. I'm Sarah Vavra, and I hope this is helpful for you.